And I also want to turn to Dr. Singh to share with us his journey of the forum with examples of how we were able to bring in policy changes when it comes to India on issues which were not often discussed, on diseases which were called poor man's diseases, but today are the highest political level priority. With that, sir, I'd like to invite you for the keynote address. Thank you.
It's really an honor and great for me to be here today, at least to come to a convening, an international convening. I can see wonderful people here. Back in 2021, when Lambert Psychiatry, Sneha, who's headed by Dr. Lakshmi, a very distinguished doctor, and ETI, headed by Sukhti Chauhan, they collaborated with our forum for mental health for a roundtable. It was one of those beginnings, actually, where we had about more than a dozen parliamentarians. I had worked on TB for a very long time, almost 12 years. We have support of more than 4 dozen parliamentarians cutting across party lines. And I saw a lot of passion in even those 16 MPs who joined us that day, and also some experts. And let me share with you that it was enormous work done by Dr. Lakshmi and also Sukriti sitting here with us, that we've been able to work on national policy for prevention of suicides. In fact, we had no policy till about 2 years ago, and we have been working on the draft for a number of years, and somehow, and I would like to compliment, thank, and I'm really grateful to Dr. Lakshmi for all the incredible work she has done in putting things together, and of course, with support of Sukriti, and well, I can take credit myself also, for at least as a forum, we have all collected these people and co-opted them, and we finally did have a policy, and today we have a policy. It's on the website, and the government has a policy, and we cannot say we don't have a policy, because that's the first thing that happened. I saw that in TB. We didn't have policy for many things. We had serological tests, but outmoded for almost 20 years. Even WHO said they're banned, only 10% accurate. And it took me almost a year and a half to get them banned and get TB notified as a disease. So a lot of advocacy work had to be. So I'm glad it happened in a shorter time, in a span of just 2 years. At least we made a big firmly in place. Over the years, our forum has been nurtured as a platform for unwavering commitment to keep mental health on the national agenda in support of all other stakeholders. A place where evidence meets accountability, where experts and elected representatives minded to sit side by side, and where focus remains firmly on what our communities need, finally. And I'm deeply honored to have made some contribution by leading that effort. Our collaborative endeavor has led to enormous progress in steps that are being taken by the government today. And the basic aim of this strategy is now set up: develop comprehensive surveillance systems, expand mental health OPDs in every district, mental well-being into school curricula, restrict access to hazardous pesticides, promote reporting, and there are many other issues also which we'll touch as more subsequently. You're all aware mental illnesses contribute nearly 18.5% of the global disease burden. Depression, anxiety, mania, bipolar disorder, psychiatric disorder. And sadly, we share the disproportionately largest burden, with 56 million cases of depression, 43 million cases of anxiety disorders, and of course, highest rate of suicide, 700 lives a day. That's disturbing, 700 lives a day. And its leading cause of death in the age group of 15 to 39. About 35% of these suicides are among those in the most productive years of their life, between 18 to 30. And mental health among youth particularly is among the pressing and also the most unaddressed challenges. Most suicides are attributed, some of us know, that domestic violence, abuse, unemployment, family disputes, peer pressure, examination pressure, loss of esteem, financial distress, also chronic illness, broken relationships, and of course, perpetuated by things like drug abuse, alcohol abuse. Well, it's a societal malaise. It is very largely preventable. We all have to put our heads into it. And poor mental health also incapacitates. Besides imposing huge economic cost, as per WHO, India is likely to suffer economic loss of staggering $1.3 billion between 2012 and 2030 on account of adverse mental conditions. Mental health is also rooted in stigma. Now, this is something that society can handle, I'm sure. Behavior complexes, discrimination within the community, ostracization at the workplace. It reinforces vicious cycle of disempowerment, social exclusion and coercion, harassment. While poverty, deprivation, job insecurity, illiteracy, lack of social justice and social inequities are major determinants, there are barriers like access to mental health care. Challenges are delivering the primary health setting. Now, this is a very important issue in the primary health setting because no one considers mental health as a health problem anywhere. Not even insurance companies, those who deal with health, because it's everybody takes mental health as a stepson. And then there is also lack of good perspective in public health leadership as far as mental health is concerned. The gross shortage of trained professionals. We don't have psychologists, we don't have psychiatrists, and I think, just at about for 100,000 people, we have 0.3%, and psychiatrists maybe 0.05%, and nurses 0.15%, and health workers 0.012%. It's as bad as that. So, these are figures per 100,000, and we are woefully short of human resource. The National Mental Health Survey has identified there are large treatment gaps ranging from 28 to 30% across huge spectrum of different mental disorders, and that the incidence of infirmities and suicides were correspondingly higher amongst women, surprisingly. Developed countries allocate 5 to 18% of their annual healthcare budget, while we allocate 0.05%. We need to build more inclusive, resilient healthcare systems, incorporating social protection, access to affordable and quality care based on principles of human rights, with a very different approach, not a biomedical approach, with a psychosocial approach than following the traditional approach. Earlier this year, the World Health Summit regional meeting in New Delhi, our forum hosted a dedicated panel on strengthening youth mental health systems. The message was clear: prevention, early intervention, and systemic support must be embedded across healthcare and educational institutions. Young people today face unprecedented pressures: digital isolation, performance anxiety, economic uncertainty, and their mental health cannot be an afterthought. The global community offers clear proof of what decisive leadership can achieve. We've seen it in Finland's case, National Suicide Prevention Initiative, through multi-sectoral coordination, deeper community engagement, and research-driven policy led to measurable decline in suicide mortality, particularly among young women. Now, this reinforces what we already know. We know where the problems are, but we need to find practical solutions. As we take forward India's national mental health commitments, there are few things we simply cannot lose sight of. First, care must reach every district, not just our metros, not just where resources already exist, but places where support has rarely been available. Second, the people who meet us first in moments of crisis, our teachers, our ASHA volunteers, our primary care workers, they need the tools and the confidence to recognize when someone is struggling and to respond without hesitation. Third, prevention has to begin where we spend most of our lives: in our classrooms, in our colleges, in our campuses, in our workplaces. Those spaces must become safer for our minds, not just for our productivity. We also need to keep dignity at the center. The words we use definitely matter. The way we speak about mental health determines whether someone feels seen or silenced. And finally, we must build systems that help us understand what is happening on the ground early and clearly, so that our response isn't delayed by the time data catches up. These aren't abstract goals, friends. These are foundations that will allow every person in every corner of the country to access support when they need it most. Even the WHO recognizes that mental well-being is shaped by a wide range of social, economic, and environmental factors, not just medical treatment. It would entail coordinated, very, very coordinated, with complete synergy, cross-sectoral collaboration across spectrum of areas like agriculture, education, labor, media, urban development, social justice. Even policy, research, service delivery, and community engagement must continue to reinforce each other, not operate in silos. The Policy Network Forum for Mental Health will continue to focus on three priorities. One, ensuring suicide prevention remains a clearly articulated objective within national and state planning. Secondly, supporting the effective rollout of services so that people can access help without delay and hesitation. Enabling collaboration across institutions because sustainable change emerges when multiple sectors work towards shared outcomes. At its core, our work is about creating environments where people can seek help early, where distress is met with timely support, and where care systems are designed around dignity and equity. I hope today's conversation helps us identify how we can strengthen these bridges between policy design and everyday lived experience. Finally, thank you, all of you here, for engaging these issues thoughtfully and constructively. And I'm also grateful to Vandanaji for being with us today. I look forward to the perspectives our panel will bring to and opportunities that this dialogue will open for continued and meaningful reform. Thank you very much, ladies and gentlemen.